Once again, we're back live at the Cox Convention Center for the 2013 Bart and Nadia Sports and Health Festival. I'm Dave Morris with News OK, and I'm joined now by Dr. Terry Cline, Commissioner of Health, Secretary of Health and Human Services. It says it right here for the state of Oklahoma. Sir, thanks so much for your time this morning.
Oh, it's great to be here. I can feel the energy in this room. It's pretty exciting.
We are live streaming just outside the rowing event, so occasionally during this live broadcast, bursts of joy and encouragement will break out from behind us, so we may hear that in the speakers behind us. Sir, give us a recap of your position and your role.
Sure. I have two different roles. One is as the Commissioner of Health for the Oklahoma State Department of Health, and the other is as Secretary of Health and Human Services for Governor Mary Fallin. So our job really is to improve health across the state, create an environment of wellness, and where we can prevent injury and illness.
Well, let's talk about health. Why is that important, and why is it important to promote it?
Well, every single person obviously is impacted by their health and by the health of their family members and people that they care about. It's important to our economy. It's the workforce of tomorrow. It's important to the schools. There's not anyone in our state who should not be concerned about not only their health, but the health and welfare of their fellow Oklahomans.
What about events like this? Bart Conner was on this morning and said, hey, we expect 10,000 people here at the Cox Convention Center. And I should mention at this point, it is free. It runs till 5 o'clock today. But 10,000 people getting involved in a healthy lifestyle event. When you hear that, what do you think?
I think it's very exciting. And you can feel the energy in this room. And the good news is, you're not talking about people, as you look around, there are people here who are not athletes, who are not people who have committed their entire lives to health and wellness. There are people here who are here because they want to be exposed to an environment of health, and that will make a difference for them. It's really about changing the social norms and the expectations. If you've always been obese, everyone in your family has been obese, that's the expectation. And as a country, that's a real challenge for us, and in Oklahoma, it's a real challenge right now. Oklahoma ranks 45th in terms of our obesity rate relative to other states. It's kind of the norm. Events like this really help to change that norm. We are surrounding ourselves with people who are healthier, who are making that commitment. Everyone in the state can do the same thing.
Joe Jacoby from USA Canoe Kayak was on earlier, and he spoke about the growth and change in Oklahoma City, and it's not any one thing. It's a whole bunch of little things. You're talking about changing social norms. I'm guessing that's the same thing. It's a challenge. It's a process. It's a whole bunch of little things.
It's a bunch of little things that all come together. And it really, part of that is about the will of the community. It's the will of families. It's political will. I saw Mayor Cornett earlier, and he's made an incredible commitment to wellness. Governor Fallin has also made that commitment. So we're seeing the political will there, although we still have some big challenges around tobacco and other things. But some of those small changes that really add up and make a difference. Do you have sidewalks in your communities? So we talk about, you need to get outside, you need to be a little bit more active, be out and do things with your family. If you don't have sidewalks in your communities, it's hard to do that without putting your life at risk, out walking in the street. We don't want people doing that, obviously. Do you have green space for your families to come together, to actually enjoy being outdoors? If you don't have those types of things in your community, then you're 2 steps behind. It's more of a challenge. So the city is making that commitment. Miles and miles and miles of sidewalks, miles of walking trails, commitment to parks, to public transportation that will actually be used, so people will walk to public transportation and then use it to get across town. Those are commitments that the city has made, and actually a commitment that the citizens have made when they decided to pass those taxes for MAPs and MAPs 2, 3. That's the commitment of the citizens of this city to improve the health of the entire community. It's pretty cool to see it.
You know, the walkability of a city really does make a huge difference. You go to another city like an Austin, and you really can kind of walk around and get around. I'm guessing that is one of your challenges in your role, is to work at high levels with whether it's Mayor Mick Cornett or Governor Mary Fallin to encourage those sort of things, to provide opportunities for the common citizen.
That's right. So part of the challenge in public health is, how do you make the healthy choice the easy choice? So what can you do to eliminate those barriers, those things that get in the way for that? And sometimes it's not easy. So we say to you, you should eat a little bit more healthy. When you have fast food on every single corner, and you can double the size of that for a few pennies,
right.
And especially if you have limited income, that's a challenge. You have to feed your entire family, and if the cost of the banana costs the same as a box of macaroni and cheese, and you have limited income, the healthy choice is not the easy choice there. You can't do it as easily as just stopping at a store.
So how do you bring up a great point there. How do you fight that? How do you change that social norm?
Well, there's some really, really creative programs, farm-to-school programs that are actually bringing fresh produce during the season from local farmers into schools. That's pretty cool. We're working with a lot of schools and communities to develop community gardens so that people are actually, reconnecting with that whole kind of food line there, so that people understand the value of that. And if you're producing it yourself, then obviously you're bringing down the cost versus having to, truck it or ship it halfway around the world to bring to a grocery store here. We can help promote that at the local level. Everyone wins with that type of thing. Tobacco is a huge, huge challenge in our state right now. 26.1% of our adult population smoke.
Wow, still that high.
1 out of 4 today. So 1 out of 4 people are engaged in the #1 preventable cause of death in Oklahoma and in the United States. That's driving up cardiovascular disease rates. We're trying to pass a law right now that would allow communities to have the right that they had 20 years ago, which was if they want to get tougher on tobacco ordinances in their community and go smoke free, they should have the right to do that. Most people don't realize there's a state law on the books right now that prohibits communities from getting tougher on tobacco ordinances. Yeah, state law. We tried to change it the last 2 years. There are 12 paid tobacco lobbyists who are fighting that law because they want to see those rates remain high.
Sure.
And they're doing a great job of again, making it more challenging for people to make the healthier decision. We need to change that trend.
We are live streaming at the 2013 Bart and Nadia Sports and Health Festival, and as you can hear behind us, there is some rowing. I don't think it's corporate rowing at this point. I think it's individual rowing. My producer Paige Dillard is nodding her head back there, so we think so. But apparently, it's pretty exciting.
It sounds very exciting.
It sounds very exciting. Right. Look at the crowd here.
No, it's phenomenal, and people are really, really engaged. You have a lot of people who are in the activities, and you have a lot of spectators. I mean, people who are just excited to be here and to see these events. It's fantastic to see it.
It really is. Like I said, Bart Connor said there'd be 10,000 people, and right now there are several hundred right here on the arena floor watching some ladies doing some individual rowing. Dr. Cline, what's new? What's next for you?
Well, it really is about building this kind of excitement. So you take what's happening here as a microcosm or in Oklahoma City and trying to spread that across the entire state. This is how we change the culture. How can we really create a culture of wellness? There's an incredible amount of conversation about how we change the health care system. And really what we need to do is change our entire culture. So we're not putting all our money in picking up the pieces with a sick care system. And how can we really promote wellness so that we have a healthier population? Now, I don't want you or anyone here to struggle with managing a chronic disease for 30 or 40 years. Right now we have an epidemic of diabetes that's caused by obesity for junior high and high school students. I mean, think about that. This is the way you change that. This is the way you create that wellness, fitness. You drive down those obesity rates. You have people who don't want to smoke because they know it's bad for them. It's going to impact the way they feel. It's going to impact the way they perform at school and businesses. It's a lot to change, but there's a lot to do. And we've seen progress in our state as well.
Well, this is one of those events that can help with that. It is family friendly, and as I mentioned, this is free till 5 o'clock today at the Cox Convention Center. We see a lot of families, a lot of kids out here, so if you're out there watching, if you have a family, if you have a kid, bring them on down. Dr. Terry Cline, it was great to meet you, and thanks for your time today.
Thanks for having me here today, and good luck with the rest of the event.
Absolutely. Thanks. Again, our live stream on News OK will continue until noon. This event continues till 5.